Hello, and welcome to Appleton Engaged. I'm your host, Timber Smith, DEI Coordinator for the City of Appleton.
And I am Andy Anam, the Communications Manager for the city.
And Appleton Engaged is a podcast that explores the many people, organizations, and resources that make our community a great place to live, work, and play. So whether you're a longtime resident or just getting to know Appleton, join us as we learn more about our community together.
For more than 115 years, this organization has been helping people rise above the challenges of mental health. And as we all know, mental health comes in many faces. And what they offer is one phone number. And once you call, they will customize a treatment plan for you and walk you through the entire process, and you will get the help you need.
Well, that sounds promising, and especially since mental health right now is such an important part of our community and making sure that we're creating the best possible environment for our residents to live in. So I'm pretty excited about this week's guest and organization. So this week's guest is Mary.Wolff, Operations Manager for Rogers Behavioral Health Appleton, and Lisa.Brown, Community Relations Liaison for Rogers Behavioral Health. How's it going, Mary and Lisa?
Hello. Hi, thank you for having us.
Hey, thank you for coming and being part of Appleton Engaged. We are excited about this conversation we're about to have.
Same.
All right. You ready to jump in?
Absolutely. So I'm Mary, and I've been a nurse for 24 years. I went to nursing school at UW-Oshkosh, graduated, and knew immediately I wanted to go into mental health. And I have been in the mental health, behavioral health field for about 15 years, and I love it. It's my passion, and it's the reason why I also stayed in the area. So I was from the Milwaukee area and decided to stay up here and have been here ever since.
Oh, that's awesome. Well, we're glad you decided to stay, and we have a preference towards Titans around these parts.
Hey. Yeah, so my name's Lisa.Brown, and I am a two-time alumni, UWO. I maybe was there when you were there also. Maybe. Just learned something.
I graduated in 1999.
I'm not going to date myself.
Yeah.
But I did get my undergrad and my master's program there and lived there for a while. I had 3 children who are now adults and then moved to Neenah. But I certainly have connections to Appleton because I eat here often. Eat, work, and play in Appleton. And I'm loving all the Mexican restaurants, and really the return to the Latin roots are amazing here, authentic foods and farmers markets. So thank you for having us here today.
Oh, I liked everything you were talking about, too. Hey, I'm not going to date myself either, Lisa. So I am with you, and I am all about all of the lovely cultural food options that we have here in Appleton. Mm-hmm. They're pretty amazing. Okay, so can you please tell us about your resource at this time? Mary, let's start with you.
Sure. So Rogers Behavioral Health started as a hospital in the Economowoc area, and we have 2 other hospitals in West Dallas and Brown Deer. We also have clinics throughout the country. We have several clinics in the Wisconsin area, so Kenosha, Sheboygan, Manitowoc, Madison, and Appleton, of course. And Rogers also has some other programs like residential, sober living, and now outpatient services. We, as Andy had mentioned, we've been around for over 100 years. We provide specialized treatment. The different topics that we cover are mental health and addiction services. For the mental health, we do OCD, anxiety, depression recovery, trauma, eating disorders, and then we have something we call primary behavioral health, and it's kind of an introduction to mental health recovery. And then we also have a wide variety of addiction services.
That's super interesting because I don't hear a lot of other resources talk about serving some of those specialized things like food addiction and those kinds of things. So this feels like, is Rogers one of few?
Rogers is known for our eating disorder treatment. So we have inpatient, where you're staying overnight in the hospital for eating disorder. We also have residential, where you may be staying there for several weeks or a couple of months at a time. And then Appleton, we offer PHP and IOP, and really what that means is it's 6 hours a day treatment or 3 hours a day treatment. And we also offer outpatient services now, too. We also offer trauma, and that one and OCD are ones that we kind of specialize in.
So you talked about the levels of care. So all those levels of care are available in the Appleton one, or sometime you have to like based on the parameters or the diagnosis of the patient, you might have to tell them to go to another center which is affiliated to Gan Rogers.
Correct. So Appleton offers the 6 hours a day treatment or the 3 hours. We will refer if we need to get whatever kind of treatment that you need, but often we're able to keep you in the same system in Rogers. It just might be not in Appleton.
What do people primarily come and see you for? And also, how big is your team?
So we have 40 people on the team, and that's everybody from the psychiatrists, nurse practitioners, nurses, therapists, our school liaison, our administration staff, and of course Lisa, who helps us with community relations. And we will have in-person, and then we can also offer virtual. So sometimes they're meeting with the team virtually, but we work together pretty closely. And then we also work, of course, with the other teams at the Rogers facilities.
So you just talked about community relations. So Lisa, my question to you, like what kind of relations you have to do in terms of outreach, and which all places like schools or colleges, where exactly you have to reach out to build those connections?
Yes, thank you for the question. Outreach is fun. It's great talking to people and finding out what their needs are. And Rogers is great about being very responsive. So many times we have developed community programming and treatment programming around trends that we see in the landscape of, what's happening. So according to the different program lines, I'm outreaching to people who would see those ill folks, the gatekeepers of referring, if you will. So if we have an eating disorder program, I'm going to reach to the dietitians. I'm going to conferences. I might go to doctor's offices and clinics. For the youth programming, I'm going to meet with schools. I might meet with the booster parents or coaches, so I'm always looking ahead. We have 2 cohorts that run all the time of our mental health and addiction services because of the community need. So I'm reaching out to shelters and crisis workers, police, drug courts, places where they might see people who need treatment. So I go in all different ways. So sometimes it's meeting with one person, having a coffee. Sometimes it's doing a whole luncheon for 65 people, bringing presenters in. And sometimes we just build their skills too. So we do actual trainings to corporate places and anything so that people know when they come across someone with mental health. It's kind of very old school thinking to think you have to go to the hospital. And those days are kind of over. Now we all want to be responsible for helping someone and walking them towards care.
Lisa does an excellent job, too, of personalizing what we do offer. So it's kind of scary if somebody hasn't come to a 6-hour or 3-hour program before. Yeah. They don't know really what it's like. And so Lisa will talk with people, and she'll do a tour, kind of walk people through what a normal treatment day looks like. And sometimes that's just what they need. Then they can visualize it.
I was going to say, we've had the opportunity to sit in on a Rogers training in the past, Andy and I, and it was really, really good and informative. We learned a lot in that.
What one was it?
It dealt with diversity.
Wonderful. Yes.
Yes. And since we were talking about that now, what does the demographics of who you serve look like? Is it mostly young people, adults, everybody across the board? Is there one you see more than the other? What does it look like?
First of all are welcome. So we see a wide variety of different people in different walks of life. For our child and adolescent population, it's smaller. So about 12 would be our max right now. If there's a community need, we definitely would have more. And then the rest of the population is adults. And for adults, we see everybody from 18 to senior citizen. It's really wonderful, and that's why the group dynamics work a lot, is because people are coming from different backgrounds and have different experiences, and you're coming together as a group. So we will see people that might be homeless, and then the person next to them might be a CEO. It's kind of a nice combination of everybody.
So what are some of the challenges of your job?
I think one of the challenges of the job is just that we are doing the right thing. And this changes over time. And that's part of my job, and that's what I like about my job, is to constantly be hearing the feedback from patients or families, friends, and then also from our community. What needs do they need? What are they struggling with? And so Lisa, this is where she comes in. She's so helpful this way, is that she'll be hearing things from the schools or from providers saying, For example, the wait list is too long. We took that into consideration. We really worked hard, and now we strive to never have a wait list. If you want to come in, we will get you in. It might be a little bit different than what you were hoping for. We might have to say, could you do virtual for a little bit, or could we have you go to our Sheboygan clinic, which is closer, things like that, but we strive to never have a wait list. So that's something that I really like about my job, because we're always trying to find what can we do better, how can we serve people more.
What's something that would surprise our Appleton Engaged listeners about the state of mental health right now and trends that you see?
I have one. I hear a lot about long wait lists and just such a mess to navigate. It's so difficult. I tried. And some of that is certainly true, but I want to tell everyone, I wish you would call Rogers, because psychiatric, if you need medication for behaviors, we also do that. And I think a lot of people don't know that. So you could refer somebody to Rogers to receive behavioral medication, and it would be U.S. mailed right to their residence. All the appointments are virtually, so you don't need to go see a psych, and it's within 3 days. So please, if anyone needs medications, maybe you like your counselor or you're doing good at your job, but you know that you just need some medication support. I think that a lot of people don't understand we have that at Rogers, and you don't have to be tied to any treatment program if you only wanted.
So my follow-up question is and this comes from a standpoint of being an immigrant in the country, and I know there are many communities which are coming in the Appleton and Fox Cities area. Is it sometimes the cost part of it that stops a person from reaching out to Rogers, or is it like, I need to have an insurance, how will I pay for my medications, or can I pay for the 6 hours or 3 hours? Is that some of the questions you always find?
Yes, that is the number one question, Andy. So when we have a very robust patient access team, if you call our toll-free number or go to rogersbh.org, the very first thing when you refer, you fill out the downloadable form, right? And then our patient access team will phone the patient and have a screen. It's about 15, 20 minutes, but we're vetting out the insurance. Can you even be our customer? Most times we can serve them. We do take Medicaid. That also people don't always think we do. We take many commercial insurances to include TRICARE for veterans, but we can also assist. So if someone is underinsured or they don't have it, we also assist and can handhold, support them back to the consortium or how to get the insurances that they need and get that support. We also have some patient care grants and access to that. So we have a whole very dynamic website, and there's a part on there, patient financing. How do you finance your care? But that doesn't stand in the way for people to come. We'll work something out, help.
That's wonderful.
All right. So it sounds like you do a really good job to try to remove as many barriers as possible. What's a barrier that might pop up that you sometimes can't get past?
Transportation for some of our patients is a struggle. And that's something that we are aware of and something that we're trying to address. What else, Lisa? Because I know you hear from a lot of people.
I have access to some chatter, if you will. So whenever somebody gets referred, I can see all the notes and the trail. The people who it doesn't seem to be a good fit, so they maybe are referred elsewhere, are folks who have, in the last 30 days, there's some violence tied to their behaviors. We are located across from the Fox River Mall in that kind of rose-colored mirrored building. We're in the corporate suite there. So, for example, we take youth 12 and up. And if these are youth that are blowing out of school and they just cannot sit for the 3 or 6 hours and they're going to run, it's not going to be safe for them. We don't have, the supports to track them down and hold them down. And also the care for everybody is paramount in staff safety. So if someone is very violent, we may take a look and see if they need a residential setting. Are they willing to explore some medications to maybe address some things? But if it's just a very violent situation, there's other places that are better suited so that they don't get in the way of other people's treatment. Also, you need to be literate. So Rogers makes their own curriculum and workbooks. So sometimes we'll have people who cannot read. We do have use of Chromebooks and apps and translators and interpreters. But for the most part, if they're at a low cognitive functioning, they also may be better suited for treatment elsewhere.
What is a myth that you think the public typically has about mental health or the state of mental health?
I think a myth that a lot of people have is that it's a problem that other people have and not something that I have. And good mental health is for everyone, right? So a lot of the modalities that we use, like cognitive behavioral therapy, it's teaching skills. It's teaching skills how to manage life stress. And we all have life stress. So I think over the years, the stigma has been reduced. I think there's been a lot of good work that has been done to make mental health more public and more acceptable to talk about. But still, when you're having a general conversation, and I tell people, I'm a psychiatric nurse, I work at Rogers, a lot of people don't say, I have no way to kind of relate to you about that. And the fact is that if you live long enough, most likely you're going to run into a situation where your mental health is affected.
So is there a story or stories you want to share that shows the impact of the organization?
Well, I could tell you stories all day. I can speak about some of our kids. One of the barriers, you asked, barriers to care. Sometimes when an adolescent comes in, they don't want to be there. And that can be a barrier. Typically, it's their parents or guardian that wants them there, that's seeking out the help and knows they need the help. But maybe the kiddo isn't convinced quite yet. And on the first day, it's very hard. It's a little scary. And so we always try to meet them where they're at and kind of walk them through the process. And it's really kind of beautiful because over time, they warm up. And we'll hear things like, how come I never was taught these skills in school? And the families can also see it too. We offer a program, it's called Family and Friends. And this is for families, friends. It's usually the parents or guardian that attends. And it's a program that we offer once a week. And they attend virtually, but they're getting the same information that the kids are getting. So general mental health guidelines and kind of ideas, and then also learning the same skills. And this is really nice because then they're learning it in treatment and we can reinforce it there, and then the parents can reinforce it at home. And then come the last day of treatment, that same kid that maybe didn't want to be there on day one, now all of a sudden is kind of having mixed feelings, and might be a little bit nervous to actually leave us. So we have a kind of a fun activity we do with them, and it's really powerful. We'll ask them to write a letter to another kid on their first day. Kind of like, what advice would you give now that you've been here for the whole course of treatment? What advice would you give? And they write these beautiful letters, and it's empowering for them because they can see how far they've grown and how far they've come. But then it's also nice with the staff. We'll share them too, and we read them, and it's just a good reminder of the good work that we do and that we do have an impact on people.
Lisa,
Yes.
do you have stories too?
I have a story. So I have the joy of going to community conferences and different organization conferences, and I'll work a booth different places to promote different program lines, so people will come up to me and share. And I have met so many people in recovery or they're in their wellness, and they tell me their life stories. So I've had people tell me, both of my parents got clean there. Or I'm thinking about one specifically, a former colleague of mine that I knew, and she said she came to Rogers, what treatment was like for her. The staff were amazing, and before her coming, she had a planned suicide plan. And this treatment and this program, before the end of it, of the 6 weeks, she said she almost didn't even want to leave, but they prepared her with a discharge plan, connected her with a warm handoff to what's her network like after, and just tears in her eyes. She stood telling me, here's someone I used to sit across from and, talk with at a meeting. And it goes back to your point, Mary, that it's not those people, it's all of us. It's our family, it's our neighbors, it's all different types of needs. And hope that people just ask more, ask twice, if people need help. But those stories always get you.
We offer an opportunity for people in our addiction recovery program that after 1 year of no relapses, that they can come back. And people take us up on this, and it's so powerful. And they'll come back after a year, and they walk through their story, and they're talking to the patients that are currently going through treatment. And everybody loves it. The person that's giving the information, everybody receiving it, the staff. And that's a really wonderful testament to all the hard work that person did.
Absolutely.
Are there any upcoming initiatives, events, or engagement opportunities?
Yes, super excited about something. So we have a new program for U.S. military and veterans. Just the way they describe it is anyone who's worn a uniform for even 1 day. As a daughter of a Vietnam veteran, my dad is very highly decorated, Purple Heart, Bronze Stars, what have you. He could have benefited from this program when I was a child. Wish he would have had it. And it's something now that we offer all virtual, so we can reach across the whole state. It's 8 a.m. to 11 a.m., all just signing online, and it keeps the military and veterans together. The real kind of kicker is it's facilitated by Rogers staff, who are also U.S. military or former veterans or veterans. So just thrilled about this program that will address the guilt they carry, the moral injury, possibly some addiction issues, suicidality. So it's called Firewatch, and that's something that you can refer the same way right through our website, and that's just busting at the seams now, so we're excited.
I'm hearing one thing, that the virtual option has really opened a lot of avenues.
Yes.
Like, it has gone beyond the barriers of transportation and offering the help people need.
Yes, and you can choose to come to Appleton programming virtually or in person or hybrid of sorts. If there's a program going on and you want to pop on virtually just the first week because maybe you've been struggling with anxiety until now that you know these folks, you actually want to attend, then we can individualize it like that.
That was a change from COVID and something that came out of the pandemic. We didn't offer virtual prior to that. And then we had a pivot, and the community needed this, and we were all virtual for a while. And then as we could slowly start coming back, we understood the power of the virtual option, being able to reach more people in need. We also have a virtual clinic that's started this year, which is new, and they offer a lot of wide variety of programs throughout the whole state.
I would just add right now, there's zero wait list for any youth ages 12 to 18. And I go out and I speak to a lot of school pupil services when they're struggling with kids who are school avoidant, truancy, which we know was just a huge epidemic after the shelter at home. Right now, anyone can sign on and within the week start mental health treatment for 3 or 6 hours a day. So we hope that nothing stands in the way of people getting the help they need.
That's great, yes.
Is the virtual option pretty popular?
I think there's a lot of people that do like it. We also see the people liking the in-person. Mm-hmm. So it's really kind of individual. There is something special, kind of like what we're doing here. You're sitting in the same room, sitting across from each other, and you're sharing. So I would say some people just get kind of whatever their preference is.
What can community do to be helpful?
Well, I'm hoping that people will contact me or ask for me to come out because I can present to any team, individual, any organization if they're interested in hearing more about mental health. I like to bring breakfast or lunch and come out to partners to just talk about how to refer, and it's nothing that you're on the hook for any money if anybody refers. It's just warming somebody up to getting the care. We'll call the patient and find out, what their needs are, what have they already exhausted, what would be available for them, does it work out, but there's no harm in referring. So any community member who would like to hear more could reach out and contact me. I'd love to talk with them.
Who can people contact if they would like to learn more?
Yep, so my email is Lisa.Brown @rogersbh.org. And just shoot me an email and I'll see when we can come out.
Is there any additional information you feel is important for the Appleton Engaged listeners to know that maybe we didn't ask a question about?
I think it just want to make sure that people understand it. If you have a question, call our 1-800 number and reach out and ask. We have a lot of trained staff that know how to answer the question or get you to the right person. And so I just want people to know that we are available to you.
And now is the best part, the shout-out time. Who do you want to send your shout-out to?
Well, I definitely would like to shout out the Rogers team, especially the Appleton Clinic. We're very lucky to be working with a group that's very hardworking, but also pours their heart out into the work that they do. Very passionate.
And fun. You can go into any room, especially the youth room. The youth, they're in there roasting each other, having fun, doing arts and crafts. They have catered meals. They're a great group. Part of my training when I started was to sit in the different treatment groups so that I could speak to it. And I learned so much. I would refer any family member I had, any neighbor I had. It's a loving group. Definitely.
Absolutely.
Yeah, definitely. I would like to shout out our community partners, specifically Appleton Area School District and Tim Arnold, the referrals and the welcome, so that we partner with them often. the Outagamie County Health and Human Services, their public educators, the nurses there, and we're going to be having a school lunch, or a school counselor and school nurses luncheon. So we really want to talk to all those people, personnel. They are huge partners with us and the hospitals. St. Elizabeth is probably our top referent, Catalpa Health. So we refer back and forth. It's something that works for us, might not work for someone else. Patients can go back and forth and know that they have options.
And we also want to shout out Timber, Andy. Thank you for having us. This has been
It's
a
our
wonderful
pleasure.
opportunity.
Yes, thank you.
And we want to say, Mary and Lisa, thank you. At this time, Appleton Engaged listeners, we're going to start wrapping up this episode. Thank you for spending time with us. Thank you for giving us your minds and your ears. Thank you for wanting to learn about another amazing resource here in the Appleton region, helping to make our community a better place. As you know, Appleton Engage, we are a work in progress. We are trying to become the #1 podcast in Northeast Wisconsin, and we can't do that without your help. So a couple of things we could use. As you listen to an episode, if you think there are more questions we should ask, let us know. If you would like to be a guest, let us know. If you'd like to recommend a guest, you should let us know. And you can reach us at diversity@appleton.org. Once again, that is diversity@appleton.org. Also, we think we have something really, really special here with Appleton Engaged. The more informed our community is, the better and stronger the community is. And so we think we would like to get more listeners. How do we do that? Well, we need better analytics. So while you're listening to this episode, take a moment, hit that subscribe button. If you've got a few more moments, go ahead and give us that 5-star rating. And if you've got a full 2 minutes, go ahead and write us that review. All of these things increase our analytics, and the better our analytics, the more people, more eyes and ears and minds learn about this amazing resource known as Appleton Engaged.
Remember, mental health does not affect the person but the entire family. And here is a resource in the region which gives you the convenience of either getting a hybrid or in-person or virtual. So if you are facing, or you know someone you love is facing a mental health crisis, you should just call the organization and see what they can do for you. Go to their website and check out and get the help you need. Thank you so much, both of you. And until next time, stay thoughtful, stay curious, and stay engaged.